We're going to be then going to sidelying. And the first things we want to do is make sure the sheet is not like this, okay? This is really the biggest trick you need in terms of getting a person to be able to turn on the table effectively, is have this top sheet up, passing over their shoulders. You should be able to basically, if I were, I don't want to do this with people, but I should be able to contact the entire edge of the table with this sheet, all right? I don't have to fully turn them into a ghost, but it's better that way than the other, okay? Now, did I have one side versus the other? It doesn't. So here's where I can check. Which knee was that again?
Right.
The right knee. So this one.
Yes.
And I can confirm that as well as from, myself, for them, all that. Ideally, I would interface with this after the first round, the other side. So I want to compare it to the other side. If I want to clarify for a person which side I want them to lay on, then I'm going to indicate, okay, I'm going to get the sheet ready, and then what I'm going to have you do is you're going to lay on your left side with your right side up. These tactile things go a long way, all right? If you just say right and left, if you've done a good job, they aren't processing things effectively anymore. So, and even for you, right? Just be like, I want you to lay on this side with this side up. That's going to be a much easier way of messaging this, all right? Now, next will be, I pin the sheet on one side of the table with my leg. I usually stand strategically in a way where more the back of my body is to the front of them. That way, even if they did, because if you're in a closed space, there may be less concern as long as you're not standing here at the head of the table, right? If you're standing on the side of the table, looking that way, even if they did flail around, they can catch themselves and everything's good. So I stand like this. It also keeps it where if their hands flail, they're not going to hit the front of my body. I stand like that. I'm just a little bit positioned that way. I turn, and then don't tent. I know you guys have seen this, but I have to make sure I always say it for the video reasons. Don't tent like this and create literally a big tent, a lot of air to go through. Reach across as far as you can, hold taut, and then have them turn. Okay, so on this side, put this side up. Go ahead. Wow. How are your sinuses?
Yeah, all right.
Okay, now she's already got her arm out. So we're going to tuck yourself back. All right, and I'm going to have the client scoot down a little bit for me. I want their head fully on the table, and then I can even confirm, okay, good. She's close enough to the edge of the table too, where I'm not going to be reaching too much. Now I happen to be standing here, and how that played out. So I'm going to go ahead and just get the bolster in place. So underneath the knee, I tend to find this slides a little bit better on the table rather than gets caught. Sometimes gets caught in the fabric if you do it otherwise. And then get them unstuck. Make sure that's settled. Come on up. I'm going to grab this towel from you. And then did you already grab that pillow?
I did.
As a hug? Okay.
Yeah.
So the pillow that was under the abdomen then works really well for you to just say, if you can grab that pillow out and then just put it against your chest, then that becomes the hug pillow. And then that's also protecting the front of the body and then keeps them from rolling too much on you. Okay, now this part.
She looks so tucked in and cozy.
This is and that's what it should look like and feel like, right? A lot of times I think the draping we'll see in like online stuff is more so that you could actually see what's going on. Like a lot of even the protocols we show in the book, like we have to make it where you can actually see what we're doing. But a person should be really cozy and tucked in. Now, a lot of times treatment tables, you'll be told, like we have the blankets always on top of the top sheet. So then you would have this even if you didn't do the roll. But then have it up over here. I didn't mean to have it over her head. but have it completely covering. I turn it perpendicular to their body, so that's really draping the whole upper body. Okay? Next, I gotta just make sure the head is nice and comfy. I'm gonna click this. Give me 1 sec. Okay. I'm a big fan, as you've seen before, of just using the face cradle plus one of those toddler pillows. Okay, go ahead and head up for me. I'm gonna have to scoot down just a little bit more this time. Okay, good. Better to make all these adjustments now, because if I don't, that table's gonna, that pillow is gonna fall on the floor. And then I have to worry about a whole sanitation issue with that. And get these out of the way. Either click them down. I'm a bigger fan of getting even more clearance and completely moving it out of your way so that I'm not gonna bump into that and have to worry about it. So right now, we're set up for victory. Next, before we really get going, because the first place I'm gonna be working is the head. So this is where, you know, demonstration of sanitizer. And I really make sure I put it on. The one time I kind of do break contact, I make sure they're settled, all that good stuff, and then I make sure I'm sanitizing really good before I start working too much here of the head and face. Okay, the main structures I'm worried about working on are going to be the, and I almost lost track. Let me click. Gotta get that arm repositioned. A couple of other draping things. Okay, this top sheet, if I bring that over and tuck it underneath the head, sometimes just finding the corner is easiest. That'll help keep the sheet taut across the chest. Now with this in place, it gives me a lot of help in terms of I can just bunch it up and use that as a blocker for holding the sheet down. And I can undrape here. And so I'm going to have you bring your top arm back. We're going to bring this on top of this sheet. Very good. I'm able to just control that really well. And then once that arm is there, I can get the top sheet lassoed, bring this back over top of the arm, so that's nice, kept nice and cozy. But that way, when I transition to working on the shoulder area or the lateral side of the torso, all the movement, all the bolstering is done. And then I can just worry about massage and not have to change orientation. But go through the steps. I know it gets clumsy to start with, but try to make yourself go through the steps of checking all these boxes. Are they low enough on the table? Are they far enough to the edge so you're not going to reach? As well as like the basic bolsters, getting like the square bolster under their top leg, pillows that are thick enough so that their shoulders aren't squashed and their spine is nice and neutral. And then getting that arm out, and then you're good to go. Now, working here on the temples, I have my system. It's not a lot of pressure, but I'll do kind of a twist like this, where what my palm is feeling for the zygomatic bone, your cheekbone, and kind of pulling the temporalis muscles away from the ear and then away from the jaw. You could do that with fingertips like this. There's also standing kind of this way and kind of gathering more with the pad of your thumb, finger group, and then the hand planted on the back of the skull. I'm gonna try to just show what I actually just normally do. And this is one place where, as long as my biomechanics are like 95% fantastic, I can get away with certain little cheats like this because it just works better for me. Okay. Transition down into the neck area. That's great. And now we're going to be thinking about that classic spot everybody wants more work, this upper trap area. Now we've already worked on it some by doing that pull mechanic in prone, okay? So, a few ways of just distributing motion. And as I do a lot of kind of walking around, Now, soft fist is an option here. Just so you can see it better to start, what I'm going to start with is making contact with the cervical neck area and letting that guide me into this upper trap area. Now, there's also an important muscle called levator scapula here. That tends to be the one where you find kind of a ropey, very tender point. It attaches right at the superior angle of the scapula. So right about where my soft fist is. Note that it's pretty posterior. Her ear, line of her ear, is all the way over here. So I angle myself so that I'm well behind that. I don't want to get past that line of the ear into the anterior triangle of the neck. So right there is where my forearm needs to be. I draw the hair up, that's its own special art form. But same thing, sometimes I gotta kind of shuffle and reposition. I gotta really increase the angle of my elbow into that V formation. Let the neck guide me, and then I'm where I'm supposed to be. And we're gonna pick a force, or a direction of force. It's either gonna be straight down into the upper ribs, seemingly where I'm looking is going to be like right towards her feet, versus on a slight angle across. And both of those will work really good. This will be a bit more intense. Pressure. I hear great. So that's even better than good. Okay, your first dose of muscle energy technique though. I showed this just because it's one of the most useful. This is an incredibly common area for people to have symptoms, but then it's like, how do I get this to release more quickly? Okay, I'm going to have her shrug her shoulder up into me a little bit. Okay, that scapular elevation. When people do a shrug, we hold for a little while. You go and relax. That's just a contract, relax. Now I'm going to do a contract, relax, antagonist contract. Okay, shrug up into me. This ideally should be held for closer to 10 seconds. But even getting to 5 is usually testing people's patience. Okay, now slowly relax, and then reach for your toes a little bit. Look for a little stretch right where I'm pushing. That's antagonist contract. It's having her shorten the opposite muscles, thus causing these muscles to lengthen. And relax. You will get more nervous system response by having a person do both actions. Shorten what you push on, lengthen what you push on. Okay, shrug into me. Now I can even go a step further. I know these can be accessory breathing muscles. Okay, take a deep breath in, all the way in, and then with the exhale, slowly let go and then reach for your toes. And relax. A few cycles of that in particular, I promise you, it's the best value of your time in terms of getting an effect here you will ever have. If you want to know what to do for the classic upper trap area, and that also attaches all the way up to their neck and interfaces with breathing, that's one of the best tools I'm ever going to show you. Now I'm working my way up into the neck. Here, V formation, going across, upper trap and levator scapula, and I just will continue to do that all the way up the cervical erector spinae. But I just got to keep my elbow bent in that V formation, and I'm in a really good position. I'm not going to hit anything I have to be worried about. Now, if it's more of a relaxation session and there's no headache or neck issues going on, this palm application works really nicely. Kind of a more gentle, just feel good kind of a thing to do. And I'm feeling really for that occipital bone. I want to have my palm kind of wedge between the skull and the, you won't feel the vertebrae, but I'm trying to visualize this and axis. Okay, that's where my forearm would go for more work, where I'm going to contact the traps, not applying a lot of pressure. This is going to be kind of a wide stance moment. I'm going to I'm just lightly gliding on the skin until I find the base of the skull, Once I find that, I want to reposition myself so I'm comfortably able to push more straight down, not up into the bone. I want to try to wedge between the skull and the first couple of vertebrae. No pressure. Now, if I have more of a V formation, I'm going to be more posterior, right by where there's like a big nuchal ligament that comes down right off the right central, right off like your spine and connects to the back of your skull. If I flatten out and I go into more of an L formation with my forearm, I'm going to track seemingly towards the ear, but just behind the ear is a big bony prominence called the mastoid process. That's where sternocleidomastoid, another important muscle of the neck, attaches, and I can apply a little bit of pressure to that attachment site. Sternocleidomastoid, and with trigger point related phenomena, can mimic migraines. The suboccipitals, the ones just at the base of the skull, are more your tension headache. Yeah, little gremlins. Okay, something we haven't covered is working on the arm in this position. Sandy prefers it, and it's fine for me. It's not my personal favorite, but it does keep you more upright. You will notice that working in the arms, since it's so low to the table, sometimes you'll be kind of bending over more. This is a perfect way to be able to obviously be much more upright with your stance and body mechanics. And there's no reason too why you can't be using a forearm for this. Harder it a little bit, you can work on the other side of the arm, laying against the table to get the biceps and stuff, but I can pin their forearm and come across like this. And then I pin the upper arm and can use a forearm here. So, option for working on the arm. That's not our primary focus, but that's really all it would be. And then kneading ends up being a really good tactic here because it allows you to get, it's my tendency is I find working on the other arm, which is kind of right in front of their face, a little bit less comfortable, especially with draping. So if I get stuck having to work only in sideline, I'll use kneading, where my pull hand reaches enough over to the anterior side of the arm to get the biceps. And so I can do all of this and get both sides of the upper arm and even the lower arm. As long as I make those knees big enough, I can say the arm has really been worked on. You can even work on the hand, all that good stuff. It's totally an option, okay? Now you want that push-pull because that stabilizes them and keeps them from moving and lets you work on both sides. Not too hard there, just gotta make sure, again, those elbows stay nice and straight. Now if I re-drape here, I'm gonna let your arm kind of bend forward, nice and comfy. And I'm gonna have you roll forward a bit for me. If I wanted to work more on the back, okay, her arm is already kind of pinning the sheet. So I just create this bunch again. And here we go. Just a bit tight. That's where you want that huggy pillow. This is the one time I do want them rolled over. Now, this is where I would find the spine, and there's lots of options here. You could use a forearm with a V, and it works pretty good, but you need them rolled forward for you so you actually have a hill. If they're rolled back or really upright, then you can't do this at all, okay? So you can pull that off. Soft fist, and now this is working all predominantly on the side of the body that they're not laying on, right? Side of the spine. There's another way, which I heard everybody have positive responses from last week, which is where, this was something I can say, if I didn't develop it, I don't know where I found it. But if I find the spine, take a soft fist, I put it just on the lateral side of that. Now I'm working on the erector spinae of the left side of her body, the side of the body on the table. I plant my soft fist there in either another soft fist or a palm, Now, this is a case where I'm going to let gravity take me down. This is where I really need little to no lotion, otherwise I would just slip, right? So here, when there's a really sharp angle like this, you can sometimes let gravity be the thing that creates the glide for you. What's nice is it creates this sense of spread. So here we go. And just work my way down. Kind of like a nice cat paw. This also can be a place, because of the leverage and angles I can get, I can really get some heavy pressure here on those erector spinae if I want. So if you're ever having problems with clients in terms of getting pressure on those muscles right by the spine, the erector spinae, coming at this angle with the soft fist, and then they could even roll back into you a little bit if they really needed more pressure. But you can't beat that. And you can just kind of walk your way all the way down or up. If somebody can only lay sideline, then you may spend a fair amount of time. But this works really good. It's the only application that's going to take everything away from the spine like this. And then even the scapula here, I turn my soft fist over, I can let my knuckles glide along that line of the scapula. And sometimes this will even be a way where it could seemingly feel like you're kind of going under the scapula and pulling that off and away, rather than doing this weird thing. Okay. Now, returning to what we would normally do, typically in the routine, it would just be head, upper trap area, and then I'd have you roll back a little bit again. I gotta gather that arm. We mentioned some of the scapular movements here. That's gonna be my primary focus. So I gotta get on the lateral side of the scapula, right on top of the ribs. So this is where I do want them rolled the opposite way. Now I have a tactic of hooking their wrist like this. You can let their arm just lay down on top of you. But then what I do is I get my hand right on top of the acromion, which is the lateral top of the scapula. You'll always be able to find it. And I'll apply some pressure onto those ribs. What I'm really thinking more about is moving the scapula. So my elbow is on the lateral side of it, and if I pull towards me like this, I'm pulling the scapula towards your spine. If I go like this, I'm taking it away from the spine. If I go like this, I'm pushing it down. And if I bring it up, I'm obviously creating a shrug and taking it up. So down into depression, the good side of depression. Into protraction, retraction, elevation. People are almost always too elevated and their shoulders too high. So taking the scapula down into depression and back into retraction is what I'm really always trying to do for people. So down and back. I'm not even really gliding across the skin. A lot of times I do this over the sheet. So I'm kind of more stuck to the skin and trying to use my elbow plus my hand here to move that scapula around. That's my main goal, and that'll take away that sense that you're pushing down on the ribs. That'll feel sometimes uncomfortable to you and to them. Okay. Now I could drape that area, but I'm showing also when we saw how you could get there. But there's also the option to just go over the sheet here. And we just find the top of the iliac crest, sink down. Pressure, that's just right. Okay. And if I wanted to do a muscle energy here, the best one I have for you, it's a co-contraction thing. This is not a muscle firing pattern thing. If I have her just the tiniest bit, start to lift her bottom leg up off the table, good. Slowly let go. That will engage all the muscles of the lateral lumbar area, all the way over to the posterior erector spinae. So all muscles associated with the low back here will shorten and engage just with this action. Little lift of the leg, and it doesn't even have to be that big. It's a movement that even the most frail human being can pull off. Good, relax. What I like about this too is because of where we're at and how they are positioned, we're actually causing incredibly little strain on the lumbar spine. Okay, I'm not pushing it into hyperextension or anything. Okay, again, little lift. So it doesn't matter where the low back issue manifests. It can be more lateral in the obliques, quadratus lumborum, relax. It can be more related to the erector spinae, maybe guarding around a bulging disc or something. As I work my way more posterior, all I have to do is increase the angle of my form into this V formation. The same thing, little lift, and relax. Usually, if I haven't assessed it, I use this as my key place of identifying where is the main problem for a person. Is it more lateral or more posterior? As I work my way through, I'll just confirm with them. And you tell me when we find something that feels more like your symptom. And I'll replicate that more when I go over to the other side. So now if I angle myself, so here I'm more central, like right in the middle of the lumbar region. If I angle my elbow towards the pelvis, I can ideally start affecting the erector spinae as they come down to the SI joint. So the bottom of the lumbar vertebrae where it meets the sacrum and the pelvis. The same thing, even here at the SI, it's not really on the SI joint, but it's just above it. But when you work here, this is where those muscles will get really angry when there's an SI joint problem. Same thing, little lift of the bottom leg, that will engage it, and relax. So in Sideline, I'm stressing real hard in this, at least in this Sideline demo, that you want the best tools for how to help a neck and shoulder thing. Here's your angle, shoulder shrug, reach. Base of the skull, there you could include eye movements and little head rotations. Here, anything low back, you're gonna have the best leverage and capacity to kind of get good compression on it with the easiest muscle activation I can usually have somebody do. They're really safe and they're really effective. So those will be the number one things that people come in with issues for. I jumped ahead. Okay, for the hip, iliac crest, jump over top, that's where the greater trochanter is, and then this is where I could work on the rest of the glutes. So gluteus medius and minimus. And if there was more of an issue here, this will kind of show going over the sheet, but rather than it being a static compression, there being some kind of a directional force to it. I'm not gliding across the sheet like that. I'm just compressing and then nudging in a direction, lightening my pressure, compressing again, and going in another direction. Now, here, pull the sheet. It's already nice to scoot the leg back for me. Okay, but with this blanket, note with this blanket or towel being big enough and wide enough, even that helps create a buffer here. Like now the anterior leg, but there's a huge bunch just covering everything from the chest to the pelvis. It makes it just so much easier. Okay, now here's where I can work on the rest of the leg muscles so much more effectively. Going to be that whole medial half of the hamstrings back there, as well as the adductors, and then the rest of the calf muscles. Okay. So, little bit of movements at the knee. You could go as far as bending the knee into flexion like this and coming in, but that tends to get in my way a little bit. But flexing the knee a little bit towards you, Creates a little bit of slack here for the hamstrings. Can make them a little more comfortable to work on. To work on the hamstrings, it's more V formation. Adductors, more L formation. So, hamstrings, adductors. Hamstrings and adductors. Then I just switch my arms. If I create a V with my forearm, V formation at my elbow, I'm going to be real central right down the middle of gastrocnemius. Getting those two heads pliable can be really important, as opposed to more L formation coming along the side of medial gastroc. Okay. And I come around, and more for this area. Forearm works really good. If you feel you are bending over too much, just switch to either a palm or a soft fist. Either one works really good. Here for the feet. Usually getting seated, you may be comfortable like bending. Let's make sure you're doing it at the hips. I'm going to show struck it down on a knee, but you could always get a chair or a stool. But you're never going to have a better angle for these than this. So if I get down low enough, then I can work uphill through the arch. A lot of times if I'm here, then I'll start up by the heel and let gravity pull me down towards the toes. If I'm being honest, this is what I do a little bit more anyway. Watch me step and everything. The only thing you want to watch out for in terms of direct pressure on the bottoms of the feet, you won't permanently harm anything, but direct pressure into calcaneus here in the heel isn't always very comfortable, but especially where the joint of the big toe is. So people call the ball of the foot. That's the only thing you want to be careful of. If you skate around that, everything else is good to go. Okay, top leg. Using this blanket to create a nice buffer for the sheet. Scoot the sheet up. If I had to, then this foot might get uncovered. I can just do that to keep it cozy. Okay. Sarah's got that good tactic of doing more of a pull action, where you can kind of, and if I do this with a push hand here, that may cover all I really need to in terms of kind of bending the IT band as opposed to applying direct pressure down into the femur. This will be the more gentle application. It tends to be, in my opinion, all that's really needed. Now that could be done with a forearm, but I'm thinking about trying to create a tension, a torsion force, and a twist when I do that. I usually do just fine with palms here, and if we needed to get more direct, then you can line yourself right up with it and glide right from the knee, right straight towards the hip. And I can transition to the lower leg. This is where people often think about the shins as just one group of muscles, but there's two. There are ones just lateral to the tibia, but if you look at those anatomy posters, you'll see them more readily from the anterior view. But when you look at anatomy pictures, you'll see that the tibia doesn't have any muscle on the medial side of it. It has muscles on the lateral side of it. But then on the femur, over on the true lateral side of the lower leg are 3 more muscles called either the fibularis group or the peroneal group. So same thing, V formation to be on the anterior group of muscles, which are about dorsiflexion and toe extension, versus these lateral muscles on the femur, which are about eversion. Okay. Also an excellent place for your knees. So I can get my palm set as close to that tibia as possible. As I do that knee, boy am I getting basically every muscle of the lower leg. Okay. Then, underneath. For my hand underneath the foot, I can curl my fingers and create more pointed application if a person wants more pressure there, or I could flatten them out and create more of kind of a general, kind of like a squeeze on both sides of the foot. But since I've worked on the feet so many times, I don't have to stay here for too long. Okay. Great. Now, we don't have to worry about moving the pillows, ideally. A lot of times when people turn, they may fall, and that's where you might need an extra pillowcase and all that kind of stuff. What I do need to get is the arm re-draped underneath. So I'm going to have you bring that arm back and then underneath the sheet here. You can see where that becomes so useful. All right? Okay. Now, grab the square bolster and bring your knee up, back down. All right. Now it doesn't really matter, but if I were to tell you to pick where to stand, standing behind them is maybe a little bit smarter. Okay, I'm gonna have you turn over onto the other side.